Clostridium tetani by me, Valerie Brown. What is Clostridium tetani? So it classifies into the bacterium genus Clostridium and family of Clostridiaceae. It is a spore-forming obligate anaerobe that are able to germinate in the absence of oxygen. It often causes toxins in places where tissue death occurs. The endospores that it produces often swell the vegetated cell, and to the right is an example of a terminal end spore it produces, but these are only under anaerobic conditions. Most species are gram-positive, but some species can show up as gram-negative depending on samples and species of Clostridium. Where is Clostridium tetani found? This organism's natural habitat originates in soils contaminated with animal or human feces. The spores originate in extreme environments and are secreted in the fecal matter of these animals or humans. They can be found, like we said, anywhere in the environment, but commonly found in contaminated soils, house dust, and the gastrointestinal tract of human, animal, normal flora. Spores that they produce can be on fomites in these surfaces, such as barbed wire, rusted nails, and needles. Ideally, anything that can be in contact with nearby manure and direct contact with you and your skin. History of C. tetani and its impact on life. A bacteria that has been around for thousands of years that causes an acute infectious disease known commonly today as tetanus. Documents describing the symptoms found from 1500 BC in ancient Egypt. Discoveries of documents thought to have been recognized even as early as 3000 BC. So historically, wounded soldiers have had a high incidence of tetanus deaths occurring in World War I and World War II, meaning that most of these deaths weren't even from the war, but it was mostly just the infections from gunshot wounds and cuts that these soldiers had endured. With evolution of science and discoveries from scientists, this declined with widespread use of immunizations. It was not until the 1900s and early 20th centuries this disorder was being handled with more precautions, such as vaccines and aseptic techniques. Diseases C. tetani causes. So, depending on infectious dose and site of encounter, C. tetani has growth opportunities that cause trouble with the autonomic and central nervous system, from producing two tetanus toxins in the body known as tetanospasm or tetanolysm. Tetanocine. Tetanospasm blocks the release of inhibitory neurotransmitters, so it produces the generalized muscular spasm characteristics. Tetanus toxin can enter the nervous system from the adjacent muscle, spread through the lymphatic system vessels, and blood. Invade the central nervous system inhibited major neurotransmitter GABA and glycans, so this is where the muscles contract uncontrollably. Tetanolism, unknown function, but contributes to tetanus infection that causes necrosis, which is tissue death. Not good. 4 forms of this disease can be generalized tetanus, which is the most common, cephalic tetanus, which has to do with otitis in the middle ear or following injuries to the head. Involvement of cranial nerves, of course, especially in facial area. Localized wound tetanus and neonatal tetanus. Patient prognosis and testing. Prognosis of tetanus depends on incubation period. The first signs of symptoms and severity of the type of infection. Those who survive this infection do not lose their life expectancy, but conditions such as hypertonia, which is a constant stiffness of muscles, may occur after recovery. People who develop this infection through a short incubation period usually result in little chance of prognosis. Diagnosis of tetanus is not often able to be confirmed during laboratory testing, but physical exams from nurses or doctors, as well as patient immunization histories, are used to help diagnose tetanus. Physical exams are observed that look for main symptoms such as muscle spasm, gag reflex, and difficult breathing, and one other main one is lockjaw. So, patient signs and symptoms. Initial symptoms can be cramping and twitching of muscles around a wound site. Once again, lockjaw is commonly one of the first symptoms recognized as tetanus that can lead to rhesus sardonicus, which causes like a grinning of the face. Excruciating muscle spasms occur and can worsen that lead to broken bones and cause respiratory problems. Death mostly occurs due to this paralysis of the respiratory muscles and respiratory arrest. Neonatal tetanus symptoms include muscle spasms, which are often preceded by the newborn's inability to suck, breastfeed, and probably excessive crying. They get all the symptoms like adults might get as well, such as extended back and the flexion of the arms, extension of the legs, really uncontrollably movements. It is highly dangerous in unsanitary conditions in undeveloped countries with lack of sterile medical equipment. Mode of transmission. Not transmitted. This disease is not transmitted from person to person, so it is transmitted from direct contact. Exposure of bacteria from contaminated objects or dirt from the environment to minor cuts or major deep connective tissue wounds are ways to develop this disease. So spores can get into the body through broken skin, usually through injuries, and where poorly supplied blood. These conditions favor the germination process. They can also occur through injuries with dead tissue, surgical procedures, insect bites, dental infections, chronic sores and infections, intravenous drug abuse use, and accidental puncture wounds. Also, umbilical stumps are a few more that are not listed. Statistics on rate of transmission. So, statistically, this disease is very uncommon in the U.S. due to vaccinations, but can still be fatal. Other countries that lack these common practices due to lack of hygienic, safe environments, and proper health care. We have a very low incident rate in North America, but in developing countries, there's a lot of incidents in new mothers and neonates. So in the U.S., there are about an average of 30 reported cases each year. Nearly all cases of tetanus are among people who did not get all the recommended tetanus vaccinations and do not stay up to date with their booster shots. Treatment and prognosis. So penicillin and I cannot say that word, I'm sorry, are antibiotics given to kill the bacteria and stop further toxin production. It's like an antitoxin therapy with humans for the immune globulin. Tetracycline is not commonly used anymore, but can be used in substitute to inhibit growth of protein synthesis. One of the reasons why it's not really used anymore is because some people react to this antibiotic more differently, and it can even worsen their symptoms instead of helping them. If treatment is not sought early, this disease can often become fatal. Being infected with tetanus results in being hospitalized in the ICU, where proper cleaning and infected tissues and closely monitoring of muscle spasms for in case conditions worsens, so such as like the need for a respirator, and a lot of the nurses will help clean and remove the afflicted tissue, controlling the infection overall, in hopes to get better. Once this toxin-producing bacteria is in your body, it can cause an infection to the site of tissues called gangrene. If someone is to get gangrene from an untreated tetanus exposure, one of the more severe treatments can lead to amputation due to tissue death. And this is a very serious disease and can also be fatal. So treatments and prognosis continued. Most patients in U.S. who come in contact with tetanus survive and return to previous function if caught early. Older people and those who have rapid progression from time of infection to severe symptoms have a higher risk of death. Immunizations are given out to you when you are babies to help body build immunity to these infectious diseases Clostridium can cause. Booster shots are given out twice throughout childhood, and another booster dose is recommended every 10 years by the CDC after the age of 12. This is only fatal in cases with delayed medical attention. Usually, this is one of our most preventable diseases because of vaccinations. You fully recover after a few weeks with no permanent damages. And that is the end of my slide.